Good afternoon, all, and thank you for joining us today for our BFMum ante-natal webinar in collaboration with Hospital Wanita Metro and our sponsors and partner, Pigeon Malaysia. Today, we are very fortunate to have experts from Hospital Wanita Metro as our speakers. Hospital Wanita Metro is a private maternity center located in Klang. It has been involved in women's healthcare for more than 30 years. Other than providing gynecological and pediatric services, Metro offers comprehensive infertility solutions. Our first speaker for today is Ms. Enid Gomez. Ms. Enid graduated from Management and Science University, where she received a Bachelor of Science degree in Biomedicine. She has also done her postgrad diploma with Australian Society for Ultrasound Australia. Ms. Enid will be sharing her thoughts on the importance of detailed scan in pregnancy. This will be followed by a presentation from Dr. Elizabeth Thomas, who is an obstetrician and gynecologist registrar with Hospital Wanita Metro. Prior to working at Hospital Wanita Metro, Dr. Elizabeth has served with Ministry of Health Malaysia as a medical officer, working at Hospital Muar Johor, Hospital Kajang, and also Hospital Tengku Ampuan Raimah in Klang, before joining Hospital Wanita Metro in 1994. She has attended various professional courses locally and abroad, and also hold the professional membership at American Society of Reproductive Medicine. Our third speaker for today is Dr. Zarif bin Hussein. Dr. Zarif is an obstetrician and gynecologist at Hospital Wanita Metro. Prior to joining Hospital Wanita Metro, Dr. Zarif has served with the Ministry of Health Malaysia, working at Hospital Pakar Sultan Fatimah Johor and Hospital Sultan Ismail Johor. Dr. Zarif, who graduated from University of Science Malaysia, Kubang Kerian, Kelantan, as an obstetrician gynecologist specialist, also worked at Hospital University of Science Malaysia, Kubang Kerian, Kelantan. We have such an experienced lineup of speakers today. I'm sure their presentation will benefit all of you in your journey of becoming parents. You all may ask any questions that you all may have at the end of their respective presentation by typing your question at the Q&A box located at below of your screen. Please do stay with us till the end of today's session, as not only you all will gain valuable information on pregnancy matters, but also a chance to win Pigeon's award, meaning Go Mini Best Pump worth 427 ringgit. Hospital Wanita Metro is also offering a special combo package for detailed and 5D scan worth only RM 220. You all may contact the customer service at 012-238-5504 to book a slot for this combo package. We will also be mentioning the details again in the chat box later. So without much ado, let's invite Ms. Enid Gomez to share her thoughts on importance of detailed scan in pregnancy. Hi, good afternoon.
Good afternoon, everyone. Thank you, Dave, for the introduction.
Thank you so much for joining us today.
Yeah, thank you. I hope everyone had a good lunch today. Hearty meal lunch, yeah. Don't get yourself stressed out, especially during this time of pregnancy. So hopefully everyone just sit back, relax, maybe just sip some drink, have some coffee while listening to my slide, okay? Okay, today, just give me a second, yeah. Okay, I'm going to talk about the importance of detailed scan in pregnancy. What do we all know about ultrasound scan? Okay, there's so many scans outside. Yeah, 2D, 3D, 4D, 5D. Okay, the most important thing is to get a detailed scan done during 5 months of pregnancy. Detailed scan is actually in 2D mode, which is a grayscale scan. Yeah, you can't do detailed scan in a 5D. 3D, 4D, 5D, not possible. Okay, what do we know about ultrasound scan? We actually use high frequency sound wave to create the image of the baby. And then from there, we can also see through the mother's placenta and the uterus. So it's normally done during second trimester. What do we know? So it can actually provide a lot of information about the developing baby in the mother's uterus in the tummy. Yeah? So in early pregnancy, what the doctor do is they will normally check for intrauterine pregnancy to check whether it's ectopic or it's inside the uterus. So they will always confirm the pregnancy and also correlates with the baby's gestational age. They will check for the mother's last menstrual period, and then from there, they will actually measure the baby size to make sure that everything is growing accordingly. Second thing they would like to check is for multiple pregnancies, whether you are actually pregnant with twins or triplets. Yeah, in certain cases, surprise, suddenly you have twins. Okay, so at least we know earlier, then the doctor can actually helps to monitor the mother's condition. Another thing is we can look for genital anomalies. We will also know problems with the baby's placenta, especially if there's placenta tumor, or maybe when the placenta is forming a bit low. So this one will help the mother as well, to doctor to monitor the mother's condition. The last thing is we normally will use the ultrasound scan to actually monitor the fetal position, the growth, and also to check for the amniotic fluid. Amniotic fluid is like another word the doctor normally use or sonographer use is like okay, why you should do detailed scan around 18 to 24 weeks? Many people come and get the scan done around 7 months, 8 months, which is quite late actually for a detailed scan to be done. It's possible to do, but there are limitations. I will let you know why later. The best time is between 5 to 6 months is because that's when the baby's organ, internal organ, starts to develop. And then you can actually see the picture much more clearer during this time of pregnancy. Okay, the first thing is our aim is when we do a detailed scan, we would normally look for the baby's anatomy in detail. So it actually can provide a lot of information on the structure and the physical part of the baby. The scan can also provide about 80% of a detection rate if the baby has any serious physical anomalies like spina bifida. This is just an example, which is the incomplete closing of the backbone is where the spine and the spinal cord did not develop properly, okay, during the 5 months. Another thing we can look for is like cleft lips, which is the opening of the upper lips. Okay, so it did not form properly as well. Anencephaly, normally we can detect very, very early, around 3 to 4 months as well. But sometimes patient might get the scan done quite late. So during 5 months, we can also see anencephaly, which is the baby head actually grow without the skull. So, and also the brain, so it's left open. Okay, another part is we also look at the abnormality for the hole in the heart. There's so many actually, and also this is just example of it. Another part is like omphalocele, which is the baby's abdomen actually is protruding outside the baby's body. Okay, during the detailed scan, first thing, we normally go step by step. We do not rush through the scan. It's impossible to do that. And we normally go part by part and also structure by structure to have a look in detail on the baby's physical part. Yeah. So the first thing is, what do we see here? This is just an example. First, we normally will assess the mother's bladder to check the cervix and baby's position. So we check for the fetal life. What can you see here is the head down is closer to the cervix. So baby is lying in a Catholic presentation. Okay, this is another example. Bridge presentation. So you can see the head is actually up, the leg is down. The mother's cervix is actually here. Okay, so the doctor or the sonographer will normally assess how the baby lie. Then we can also see and tell the patient where's the baby's head, where's the body, because sometimes they will be curious, right? So your first, second, third baby, no matter how many times you're pregnant, you should want to know where's your baby's positioning. Sometimes they might think the leg is kicking them or the head is too low. So this one we provide a very good information. We assess how the baby position first, okay? Then secondly, we'll go to placenta. What do we know about placenta? We'll assess the placenta to check whether there's any growth, abnormal growth of the placenta. And then we'll also see the location. Like this one is anterior. Placenta, different pregnancy is different. It can form anterior. Anterior means the top part of the uterus here. It can also form posterior part of the uterus, which is at the bottom. And another one is it can form at the side, which is the left side, yeah. So it's actually called fundal. We all have to assess this to make sure that it is not low at all, so it doesn't cover the cervix. Okay, so in certain cases, sometimes if the placenta is too low, the doctor might need to monitor the patient very closely, okay, to make sure that there's no bleeding, spotting. Okay, we'll also look for the cervix as well, to make sure that there is no shorten of cervix, which is at the end, we'll normally assess the cervix later on. The next part is we'll look for is amniotic fluid. We have to make sure that the liquor is enough for the baby, okay, in order for your baby to grow very well. So during 5 months, we'll normally measure 4 pockets, okay, 4 quadrants, 4 pockets. So you just imagine this is your mommy's tummy like this, right? Then we'll measure the top first 2, 1, 2, 3, 4. So we'll measure everything accordingly, and it has to be between 8 to 20 cm, okay, for the measurement quadrant. Okay, this is just the guideline. Okay, why have to be between 8 to 20? If the baby has less amniotic fluid, like let's say less than 8 cm, we'll suspect maybe you have oligohydramnios, because sometimes in certain condition, it's a bit hard for the baby to grow quite well, and then the baby size will always be a little bit more smaller, and then just imagine it will be very cramped for the baby inside, okay? And you cannot have too much water bag as well, so it has to remain between 20 or lesser than that. If it's more than 20, 21, 22, the doctor might need to monitor you as well. Maybe very frequently, instead of once a month, you might need to go in for like twice a month for your monthly checkup, okay? Okay, the third one we'll look for is cord insertion and vessel. Okay, as you can see here, this is the baby's body, this is the spine, and then this is the umbilical cord. Okay, you can see the cord insertion here is very well intact to the baby's body. Okay, then the second picture here, this one shows the blood flow to the baby. Okay, it supplies nutrient and the blood flow to the baby. Okay, so here we can actually see 2 artery and a vein, 1 vein. So some baby actually born with 1 artery and 1 vein. So this kind of condition, we normally have to monitor them very well as well. They might need to go for a frequent checkup and monitoring. Your doctor know what's best for you, so it's important to get the scan done. Okay, so the next one is the head. We'll normally assess more for the head and the heart, because these are the 2 major organs which is very important in the baby. Okay, so the first part is what we do. We'll measure the head diameter. This is the diameter, and this is the circumference. Next, we'll assess the baby's brain. Okay, as you can see here, you can see the brain very clearly. Okay, this is the internal part of the brain, left brain, right brain here, and then this is the lower part of the baby's brain. Is at the back of your head here. Okay, so what do we do is we'll normally measure all these 3 to make sure it's in the normal measurement. Okay, so this is the cerebellum, cisterna magna, knuckle fold. Okay, there are certain measurements which are within the range, so you shouldn't exceed more than 24 weeks, because the measure might be a bit off, especially for this part of the brain. Okay, the next thing we'll look for is the face. Okay, I'm sure parents are very excited to see the baby's face. You can have a very good information regarding the baby's face, nose and lips in 2D. You can do it in 3D, 4D, 5D. I will explain to you later also. But why is that so? We need to get it done in 2D scan. 2D is a detail scan. So from here, you can actually see the baby forehead. You can see here, this is the forehead. Second part, if you go to the profile, it can provide you with a very good information as the nasal bone. You can see my baby's bone high or not. Then you can actually see the nasal bone is formed properly or not. Here you can see the nose here. This is the upper lips, lower lips, and this is the chin. Make sure baby has no shorten of chin. Okay, in some conditions, some syndrome, baby has shorter chin or no chin at all. There are some syndrome, but it's quite rare. So we will normally assess this part. As you can see from here as well, you can actually see the nose. This is the cross section, this part, cross section of the baby's face. So when we tilt the prop is the thing that we use to scan. Is example, this is the machine and this is the prop. So this thing is called the prop, the one that touching the mother's tummy. So when we scan, we go cross section to actually get the nose. So from here, you can actually see the nostril, left and right nostril. The first curve here is actually the baby's upper lips, okay? The second layer here is the lower lips, and you can see the chin as well. In another part of within the face region also, we'll also assess the eye. Okay, what do we know about the eyes? We normally call eyes as orbits, okay? So the level is orbit. So within the eye region, we actually measure to make sure it's within the same diameter. It cannot be too far apart and it cannot be too close apart as well. So it's between one gap to another gap, okay? So within the orbits, you can actually see the lens. Then you can actually have a look. There's another, within the round thing, there's another circle here. So you can actually see the baby's lenses, so you can see both. We normally put in dual screen, two screen to actually show the parents. Oh, you can actually see a baby's eye, right eye, left eye. Okay, another thing they say is my baby's eyes big. It's a bit impossible to see because we are actually taking cross section and we are actually taking the orbits part. Okay, but you can actually see in 4D, 5D scan later on. Heart section. We'll normally assess heart very clearly as well, and we normally take time for the heart section because we have to see within the fourth chamber. This is the atrium, ventricle, the upper part of the heart and the bottom part of the heart. So you can actually see the valve here. So this part fourth chamber is considered normal, okay? And then we also look at the outflow. This is the ductal arch. This is the baby's spine. This is the aortic arch. This is also assess the heart vessel. Another thing we will look for is the intraventricular septum. So this one is to make sure there's no hole in the heart and there's no defect within the midline side of the heart, okay? So you can see here, we'll assess properly to see all chambers are equal in size, the atrium, the top part, and also the ventricle, the lower part. Okay, so we'll assess the heart. Next, what comes after the heart? Okay, we'll normally put it in a pulse wave Doppler. We'll normally let patient listen to the baby's heartbeat. Okay, don't be worried if your baby's heartbeat is slightly higher than us. It's normal, pretty normal. So the fetal heart rate normally range between 120 to 180, considered normal. It's slightly higher in first trimester, then it goes down to second trimester, it will be around 150 to 160. Okay, don't panic, yeah. Baby's heart is totally great, totally normal, okay? Yeah, even though you hear it slightly louder, it's very common. Okay, the next part. As we go down, so as I mentioned just now, we'll start with the cervix, we go to the head, we go to the face, we go down to the cord, then we go down to the heart. Next, after the heart, what do we do next? We'll look for the lung area here, the lungs area, and this is the heart. Diaphragm, to make sure there's no hole and there's no gap here, to make sure that the diaphragm is actually formed properly. You can actually see this lining of the diaphragm part here. Okay, so when we assess this, we'll also look for kidneys. After the lung and diaphragm region, we'll go down and we'll look for kidneys, baby kidneys. Some baby actually born with one kidney. But the baby is still okay with one kidney, but in certain syndrome, the baby has issue with the kidney. So that's why the doctors or the sonographer will normally assess properly within the abdominal region and the body. As you can see, this is the body in a cross section. So within the spine region, lower part of the body, you can actually see the right side of the kidney and the left side. So we'll normally show this to actually compare and show the patient, the mother, okay, baby has two kidneys here, so it's perfectly fine. Next, what do we do is, we also show that the heart and the stomach is within the normal position, okay? Some may be born with the heart pointing towards the right side, which is abnormal. So this one is to make sure that everything is normal. Don't ever rush through the scan. Make sure that if you have no time for the scan, please allocate some time for the scan. It will take about 30 to 40 minutes, depending on your baby's condition. We'll never rush through the scan. We'll assess it properly. And then we'll normally assure parents, sometimes if they feel a bit tired or fatigued, we'll stop the scan for a while. We ask them to rest outside for 10 to 15 minutes or maybe take a walk. If the baby is not cooperative at all, sometimes you cannot expect baby to be awake all the time. Sometimes they just sleep through and it's a bit hard to get certain view of the organs. It's pretty normal, don't worry, okay? Yeah. So we normally assess the scanning properly and we do not rush through the scan at all. Okay, so after we assess the body, we also measure the body to make sure that the baby's age correlates. Okay, so within this is about 22 to 23 weeks. So the baby is growing pretty well, pretty healthy. Okay, the next part, limbs. Limbs is also another important part of the body. So what do we do here is, we'll tell the patient, okay, you can actually see the hands here. You can see left hand and right hand here. We'll compare. This is the lower hands, yeah. So you can see fingers here. Baby is actually holding the hand like that, okay. So another example here is to show parents, okay, digits will come together normally. Parents will be very excited to count with us. So as you can see here, this is the fingers. So this is the thumb. I put in dual view is because to actually show parents, okay, this is the thumb region here. Okay, then you can see the 5 fingers. 1, 2, 3, 4, 5. Yeah, so baby has 5 fingers, no extra digits and no lesser digits. We call fingers as digits, okay? So after the hands, we'll assess the legs. What do we see here? This part here is the thigh bone, and this is the lower limbs, tibia fibula, the lower leg, okay? The lower region of the leg. So from the leg section here, we'll go part by part. We'll go down to the feet, footprint. I'm sure parents are very excited. You can actually see both feet, yeah, footprint. Can become a footballer or can become a ballerina. So we actually show the parents, the baby foot. Okay, we can even measure. It's about 4 cm. It's quite pretty big already. And we also show parents the toes. Okay, so we can actually see the toes inside. Okay, so we'll measure both. Next is we'll go to the backbone. Okay, some baby born with a condition called spinal bifida. Some of the spinal bifida associated with some of the syndromic baby and also trisomy baby. Okay, what do we know? From the spine, we need to have 2 views, cross-section and a longer view. This image is a cross-section. This one is a longer view. What do we see from here? This one is pretty normal, pretty okay. In a longer view, I'm sure parents will understand better in the longer view, yeah. So you can actually assess the head, the neck part here, okay, cervical region, all the way going down to the body, to the tailbone, until the sacrum part of the region, and this is the baby buttock. So you can actually see all the spine is all intact. There's no gap in between, okay? So there's no gap in between. So the baby is okay, then there's no gap and there's no hole in between. We'll assess this normally, okay? The last part is cervix. Why do we assess cervix last? Okay, it's better to do it in transvagina, which is another probe where you put within the vagina cavity to have a very good view of the cervix. But normally if we scan from on top the tummy part, we will scan it later because you need to have a very good amount of fluid, urine bladder, because our bladder is in front. The uterus is behind. So the bladder will serve as a window to see the mother's cervix. Okay, some patient has incompetent cervix or shorten of cervix. So the doctor or sonographer will normally assess the cervix and to measure. As long as it's more than 3 cm, it's considered okay. And another part is we also look at the edge of the placenta. Make sure it's far away from the cervix. Okay. And then this one, I just show here make sure that everything is okay. This is an example. The age is quite far away from the cervix and the fetal spine. This one is fetal body. So the baby is actually facing head up, body down. So baby is in a bridge presentation. Okay, gender. Why you see gender last? Because I'm sure we have to make sure baby is pretty okay, physically normal. Gender will normally go last because sometimes baby close the leg throughout the scan. There's nothing we can do. So in between of the scan, we'll try to look for the gender as well to make sure that everything is okay. So for a girl, you can actually see 3 lines or hamburger sign. So you can actually see this one is actually like a hamburger, okay? We'll confirm this as a girl, and because the legs open up, there's nothing protruding out here. So for boy, of course, boy is very easy to see. You can actually see the testes here and the penis sticking out here. Okay, how do we make sure that it's a boy and it's not the port? Okay, sometimes baby is not cooperative, the leg closed. We don't see the gender when the legs is closed. We try our best to wake the baby up, maybe ask the mother to go for a walk first or get something to eat, drink, at least walk for 10 to 15 minutes, then come back and do the scan, then we'll confirm back the gender, okay? Sometimes if the cot is nearby, what do? We normally put it in a color mode to make sure that it's actually the cot and it's not the penis, okay? Yeah. And then gender scan, don't get too excited to know very early. If you through the scan, it's much more accurate after 18 weeks, okay? It's more accurate after 18 weeks. Why you can't see the gender around 3 to 4 months, provided your baby open the leg very big, very wide. If the baby is in 3 months, about 3 months, the baby's length is only about 6 to 7 cm. So it's pretty quite small. 6 7 cm is just one index finger, yeah. So it's a bit hard to see the gender because it's too small. So I'm pretty sure that gender is much more favorable to see after 20 weeks, okay? And then limitation during scanning. Okay, of course, some of the scanning depends on the operator skills, techniques, machine resolution. Higher range from machine will normally provide clearer image. Second thing, as I mentioned earlier, fetal lie and position. Sometimes the baby face down all the way is impossible to see. You can't see the face. Okay, less like what? What means by less like what? Okay, this one is a bit difficult. So let's say that if the stomach has a good amount of liqua, it will be like this. If less liqua, it will be lesser flattened. Not to say flattened, it might have disadvantages that it actually restricts us to see a good view of the baby. The final part is maternal habitus. Okay, some of us have thicker skin, so it's a bit hard to see, but I'm sure if you have higher machine resolution and if we spend time slightly longer than usual, about 40 minutes, I'm sure we can pretty see all the internal organs and also the physical part of the baby clearly. So don't worry, we'll normally take our time. Don't rush through the scan. Just take time to look and enjoy the scan moment with us. Don't worry. Or also, if you have doctors outside to do the scan or sonographer outside, just take the time, talk to them more. We'll be more than happy to actually explain to you. They'll be very happy to tell you the baby parts, internal organs, and everything as well. So don't worry throughout the scan. Okay, these are the detection rate. Okay, as you can see, we can detect spina bifida, spine problem, head problem, brain, heart, lung, abdomen region, kidneys, limbs. 3 things we can't see from the scan is a bit impossible is autism, cerebral palsy, and Down syndrome. Psychiatric illness, of course, we can't see at all. Down syndrome, normally, NICC, the doctors will offer to those who are above 35 years old and above, yeah, because you can actually see a better view of the baby's chromosome abnormalities. So Down syndrome is much more better if you do NICC or amniocentesis. Okay, why is that so? Some baby with Down syndrome are physically normal. Okay, so only parts of it is maybe is affected is maybe the heart part or maybe the facial part only. Okay, so I hope this will provide a very good view of why you should get a detailed scan done is to look at the internal organs and the physical abnormality of the baby. Don't get it done too late. There might be some limitation, especially spacing issue. Baby grow bigger, it's a bit hard to see. Sometimes, yes, it's true, you can see certain parts clearly when the baby grow bigger. Normally we can see spine clearly, face clearly, kidney clearly. But other than that, like limbs, lungs, it might need to take slightly longer time, and it's better to be done around 5 to 6 months. Thank you. I hope you enjoyed the slide. Okay, just a quick one. What do you know about 2D? 3D, 4D, 5D. Okay, detail scan, of course, you have to look at the internal part in 2D in grayscale, okay? You can't see much internal organ if you do it done in 5D because 5D, 4D, 5D only provide outer view of the face, but you can see abnormality at the face, fingers, in outer part region only, okay? 3D is a static image. This is a 4D. Now technology has advanced. Then we have 5D. We even have 6D now. It's using the Google's spectacle to have a better view of the baby inside, okay? I hope everyone enjoyed the presentation today. And then I hope you all look forward for Dr. Elizabeth's slide presentation after this. Any question? Any question?
Thank you so much, Ms. Enid, for the valuable information that you have partnered with us. There are a few questions in the Q&A box. We'll just read it out. Hi, Ms. Enid. Can we do detailed scan if I miss the weeks suggested? I am 29 weeks now. Is this possible?
It's also possible, but there are certain parts that a bit hard to look at lah, for like the limbs, the heart region, especially if baby is not in a very good position. But don't worry, we'll still try our best and we'll make sure everything is practically okay for the baby. Don't worry, you can still get the scan done. But I know some places offer partial detail scan. There's no such thing, but actually it's still best to be done between 5 to 6 months. But don't worry, if within 29 weeks, if the LICRA is still within a very good amount, let's say the baby is very cooperative, we can still see through everything. Don't worry, just get it done. Just go and get it done. Don't worry.
Okay. I hope that answered the question. Second question here by Komala. How long does it take roughly for the scan? She's very excited to see her baby.
So far, about 20, the fastest is also within 20 to 25. It can go up to 45 minutes, depending on your baby. If baby is very cooperative, we can get it done within 30 minutes. Don't worry. Okay, but sure. Actually, we normally won't rush through the scan. We'll take time to look at the parts.
Okay, I think you have mentioned it before, but I will repeat the question. May I know at what month we should do the detailed scan?
You can do it as early as 18 weeks, which is 4.5 months. But the best time is around 20 weeks, but you can go until, if you miss it around 20 weeks, you can go up until 24, 25 weeks, should be okay.
Okay,
so
great.
To answer the question is between 5 to 6 months.
Okay, so one last question here. What is the difference of anti-scan and detailed scan?
Okay. A lot of patients, they do not know. When you are pregnant, you have to remember, you have to get the scan done very early to confirm your pregnancy. That is early part of pregnancy. You have to get the anti-scan done around 12 weeks, detailed scan done at 20 weeks, and 4D, 5D done at 28 weeks. So you go step by step. 3 months for anti-scan, detailed scan at 5 months. 4D, 5D you can do later around 7 months. Why? Because the baby is much more chubby at 7 months. You don't get it done very early because sometimes it might, you can see a baby is not so chubby and a little bit bony, but still can be done. The difference between anti-scan, 12 weeks, we'll normally measure the knuckle thickness. Knuckle thickness is the fluid behind the baby's neck. If you skip the scan and anti-scan, we'll normally do knuckle fold, which is during the detailed scan. We'll still measure, but it's better not to skip the anti-scan because it actually shows the risk of Down syndrome. During 3 months, we'll normally get it done. Anti-scan will look for the neck, the measurement of the fluid behind the baby's neck. We'll look for the nasal bone, and we'll make sure that the baby shape is physically normal. Okay, so try not to skip the scan if you can. I'm sure your doctor know what's best for you and what they are offering. I'm sure they know what is good to be done at which month. And then, okay, that's is to answer the question between anti-scan and the detailed scan.
Okay, just a
Some
last one.
doctors offer anti-scan.
Okay, just last one, Miss Anit. This is from the same person. If that's the NIPT, I think it's the NICC and NIPT, do we still need to do the NT scan?
Do we still need to do the anti-scan? Depend on your doctor.
Okay.
But normally we do not skip. We'll still offer it to everybody. It's best to get it done.
Okay, understand.
Mm.
Okay, thank you so much.
Because it
Miss
has
Anit,
different
again,
function. Correct.
any last words you would like to part with the new parents to be?
Enjoy your pregnancy. Enjoy your pregnancy and take care and stay safe, everyone.
Okay, thank you so much,
Okay.
Miss Anit. Hope to see you
Yeah.
again.
Thank you. Thank you, Dave. Thank
Thank
you,
you. Bye-bye.
BFMum, for this event. Thank you.
Thank
Bye-bye.
you so much. And also a reminder to all of you that Hospital Wanita Metro is offering a special combo package for the detailed and 5D scan worth RM 220. You all may contact the Miss Lisa at 012-238-5504. We will be mentioning the number again at the chat box. So now we will have Dr. Elizabeth Thomas. As mentioned earlier, Dr. Elizabeth Thomas is the obstetrician and gynecologist registrar with Hospital Wanita Metro. Prior to working with Hospital Wanita Metro, Dr. Elizabeth has served with the Ministry of Health of Malaysia as a medical officer working at Hospital Muar Johor, Hospital Kajang, and Hospital Tengku Ampua Rahimah Klang before joining Hospital Wanita Metro in 1994. She has attended various courses and also has a membership at American Society of Reproductive Medicine. So let's welcome Dr. Elizabeth Thomas, who will be speaking on comfort techniques during labor. Good afternoon, Doctor.
Good afternoon to everybody who has tuned in.
Yes, we are looking forward to your presentation, Doctor.
Thank you. Thank you very much, Dave.
Thank you, Doctor.
Thank you for the introduction.
No worries, no problem.
Yeah. Good afternoon to all those who have tuned in. Welcome to this talk. So you have heard from Miss Enid and you have seen the ultrasound scan pictures of a baby in the uterus, in the mummy's tummy. So now what I'm going to discuss is what happens when this baby is about to be born and what you have to do at that time. So my topic is comfort techniques during labor. Now, if you ask a mother-to-be who has delivered before, what does she think or remember about her previous delivery? Most of the time she will tell you it is the pain and the suffering that she went through. If you ask a first-time mother-to-be what are her thoughts about the upcoming labor, she might tell you it is the fear of labor. Now, why is this so? Because a woman who has delivered before tends to focus on what happened. Maybe she had some difficult times in certain ways or the other for pregnancy and delivery. So she tends to remember that all the time. And if it's a first-time mother, she would have been talking to her siblings, her friends, her colleagues, or she would have seen all these TV dramas or movies where they show nothing much about the labor except a panicky husband who's taking a screaming wife in the car to the hospital, and she's screaming all the way to labor room until she delivers. Okay, so is there pain in labor? Yes, there is pain. So let us look at this picture here. Before labor starts, baby is comfortable in the womb, that is the uterus, in mummy's tummy. The womb has a door called the cervix, the pintu rahim, which is kept closed until labor starts. The womb itself is made of muscles which remain relaxed throughout pregnancy. And the pelvis, which is the passage, is made up of a number of bones which are held together by cartilage and with muscles attached to help some movement. So we have here a journey with the baby as passenger and the pelvis as the passage. Now, when labor starts, what happens? The muscles of the uterus begin to tighten. This is known as contractions. And the cervix starts to open slowly to allow the baby to come down. These contractions gently push the baby downwards through the cervix into the passage, which is the pelvis. The baby's head also rotates as it descends to adapt to the shape of the pelvis. The size and shape of the pelvis is different, may vary slightly from mother to mother. Now let us go to pre-labor preparations. Having understood your body mechanism, let us think about what you have to do before you actually go into labor. A place of delivery. Choose your hospital so that you are familiar with the place and with the doctor. This helps you to be calm. And your doctor, with each visit, will get to know you and the concerns that you have regarding labor and delivery. So you have now confidence in your doctor. And of course, your husband, having taken you a few times to this hospital, particular hospital where you have decided for delivery, he will be familiar with the route and he does not have to panic when you go into labor. When we talk about baby arrangements, arrangements for the baby's arrival should be made at least when you are about 34 weeks. That means about 8.5 months. Because by the time you're 36 weeks, you may feel heavy and a bit more difficult to move around. And you may already start having Braxton Hicks contractions. That means the painless and irregular contractions. So what do you have to prepare for baby? Maybe you want to prepare a room. Maybe you want to even paint the room a particular color, or you must get a cot for the baby, some clothes for the baby, because by now you would have known the sex of the baby. Or you can have to make arrangements for a nanny or a particular relative to take care of baby during your confinement. If there are older siblings, you have to make arrangements for them to be taken care of during your labor and confinement. Coming to your workplace, slow down your appointments at least 2 weeks before your due date, because by 38 weeks, you may go into labor. So don't be caught by surprise and say, oh, I haven't finished my work, I haven't passed over this and that. Okay, so slow down your appointments and schedules and make arrangements with a colleague to take over your responsibilities when you are not around. For confinement, decide where you would like to be. Would you like to be at home in your own place, or do you have to go to your in-laws' place, or is it going to be at the confinement center? Now, once all these arrangements have been made, your mind will be free and you will be able to focus on yourself when you go into labor. These are some of the common fear about childbirth. You may be a small built person and your doctor might have told you your baby is big. So you will be thinking, will I be able to have a normal delivery? Will it be more painful than usual? Will I know when I have to go to hospital? I am working far away from my hospital of choice. Will my husband get me in time to the hospital, or will I deliver on the way if it's a third or fourth baby? Okay, these are common concerns. So the best thing is when you go for your antenatal visits, discuss with your doctor all these concerns that you have, because your doctor has been examining you and your doctor knows the appropriate answers to these questions, and you will be able to give you the exact answer for what you're concerned about. Not every situation is the same for every mother to be. A little checklist now. So do you know what happens during labor? Yes, the passenger, your baby, is now moving downwards through the passage, which is the pelvis. Physically, your whole body is naturally adjusting to this. What do you have to do mentally is to relax. So now, let us go into labor. The secret is be comfortable, calm, relaxed, confident. The natural onset of labor is not a sudden happening. You may not even have noticed that you've gone into labor until you see a sign like some blood mucus, or you feel wet, the water has been released, or the contractions have become stronger and more frequent. And this is how adaptable your body is to what is happening. So let your body, let your uterus do what it is made to do. What do you have to do? Again, I say, relax. How, doctor, you may ask. Mental and physical. The mind tells the body what to do, and the body follows. For example, if you go near a fire, immediately your mind warns you, it is hot, it is dangerous, and you move away. Or if you're going for an interview, you also prepare mentally what to say, what to do, what to wear. The actual physical interview, you will be ready. So for labor also, be mentally prepared. Do not focus on the pain factor. If your doctor tells you you are in early labor, you may say, but doctor, I don't feel any pain. See, you are expecting pain. Don't associate labor with pain. The pain duration is only for a short while. It may be a couple of hours, depending on whether this is your first baby, second or third. Remember, you have carried your baby for 10 months, so a few hours is considered a short while. And soon you will be holding your baby in your arms, you'll be nourishing your baby at your breast. So do not listen to all the horror stories and spoil the wonderful experience of birth and delivery. Physical readiness for labor. Okay? Nutrition is very important. You must be well nourished, be energized. Take your meals on time, small, nutritious, light meals. Drink some fluids on and off to remain hydrated. You can have milk or water, juices or soups. And in between, you can take some snacks, biscuits, chocolates, sandwiches, fruits, oats, cereals, but of course not junk food. Yeah? You need energy. See, when you see pictures of cyclists doing the marathon runs, they also take bottles of water in between to remain hydrated, and they squeeze some energy food into their mouths. So that is also a kind of labor. Make sure you have energy for your labor and delivery. Labor of any sort needs energy. The common expressions that we hear as labor progresses. Ada tenaga. Saya tak makan, doktor. I have no energy. I don't think I'll be able to push. Or 没有力. And of course, the Malaysian language, Enala mudiada. So I think we have heard in various ways of the desperate call for help. Clearing the passage. Remember the previous picture of the baby? So in front of the baby's head is the urine bladder, and behind the baby is the rectum with the feces. Both the rectum and the bladder have to be emptied, and you have to keep the bladder emptied all the time. This allows more space for the baby, who is the passenger, to come through the passage, which is the pelvis. Pass urine often, because as the baby's head comes down, the pressure on the bladder allows only a small amount of urine to come out. or you may feel the urge to pass urine often. Just go to toilet and pass urine often. You may also feel the urge to go to toilet as the baby's head comes down. The common feeling is rasa na berak. This is an indication that your baby's head is coming down into the pelvis. Breathing exercises. We are breathing all the time, of course, but during contractions, you take deeper and slow breaths. Deep breath through your nose and breathe out slowly through your mouth. Do this with me now. Take a deep breath through your nose and breathe out slowly through your mouth. Okay? Deep breath in, out. Good. Now this helps you to feel relaxed and it gives more oxygen to your baby. With each contraction, the muscles are contracting, so there is less oxygen going to the baby. So when you take a deep breath, there is more oxygen in the blood that is going to the baby. Now, as the contractions become stronger, you may have the urge to push, but continue your deep, slow breathing exercises until your doctor tells you it's time to deliver. Next, we come to positions. Labor is a progressive process. So not only one position is suitable throughout. You may try different positions. This helps to relieve the discomfort of your back. It may help to stretch your pelvic floor muscles and reduce the feeling of heaviness in your pelvis. You can assume any position you are comfortable with. The secret is always be comfortable and relaxed. Your doctor or nurse who is attending to you will be able to guide you for the appropriate position during that time of labor. And also, your position of comfort may be different from another person's because your pelvis size and shape, the size of your baby, the rotation of the baby's head, and how deep the baby is in the pelvis is different at different times of your labor. So if you're feeling tired, if your labor started at night and you think you need to rest, just lie down on the bed with your knees bent. Make yourself comfortable with pillows under your knees. Or you may lie on the side with a pillow between your knees. And this helps to relieve your backache. If you are feeling energetic, you may walk about, or you may do some squatting exercises, or you can sit on the chair, leaning forward, resting on the back of the chair, with your legs put astride the seat of the chair. This helps to relax and stretch your perineal muscles. You can also have fun sitting on the exercise ball, but that will be better towards the latter part of labor, when the baby's head has gone in. There is no right or wrong way of position during labor. Be comfortable. Do what your body tells you. This is your body's feedback to the mind. Mind and the body work together. Okay? Now, other activities that you may try, pass the time during labor. You can listen to music. Let it be soothing music. If you listen to loud music or rock music, it may agitate the baby and baby's heartbeat may go up. You may ask your husband to give you light massage on the back, or you can take a warm bath to relieve the aching muscles and you feel calm. Some people like aromatherapy, so you can try any one of the odors that you feel you want to have. Lavender is calming, peppermint is refreshing, and chamomile maybe soothing. Keep the environment calm, soothing with dim lights and soft music. Having kept yourself positive-minded and happy releases the feel-good chemicals in your body known as endorphins. This is your body's natural pain relief chemicals. As you see this Olympic athlete here, okay, she and others like her, when they are in their event, they might feel discomfort, maybe a strain due to a pull in a muscle, but they are focused on winning the gold medal. So they carry on to the best effort that they can. Okay? The endorphins in their body is released, and this helps them through also. Remember, your gold medal is your baby. So focus on your baby. Talk to your baby. And do not focus on the discomfort and pain. If you have tried all these techniques, you may still need some medical aid to relieve pain. There are a few options. One is to breathe in gas. This is a mixture of nitrous oxide and oxygen. You may feel a bit drowsy, and sometimes you may feel a bit nauseated. The other option is injection, which is pethidine, which also helps you to feel drowsy and again may feel a bit nauseated. And another option, of course, is epidural, which most of you would have heard of. This is an injection given into the lower back and it numbs the nerves of the pelvis. One of the effects also is to reduce the urge to pass urine or the urge to push when it is time to deliver. So you may need assistance with forceps or vacuum for delivery. Now coming to our patient fathers-to-be, a word to the fathers-to-be. In those days, labor and delivery was a woman's world. You only see the women rushing around, getting the room ready, the tub of warm water, the clothes for the baby to be wrapped in. And where's the father? He is outside the room. He's anxiously waiting and to hear the babies cry. So he may be helpless otherwise. Or in some cultures, father may even be taboo to have the father around. But nowadays, couples live on their own. They may be in a different city, a different town, state, or even in a different country. So they may not have extended family to help. So husbands are very much needed for emotional and physical support. As a husband, you have already helped your wife to make the pre-labor arrangements. Very good. Now, what else to do when she's gone into labor? Remember that a woman in labor, however much she is prepared mentally, when it comes to the actual process of labor, she needs emotional support during this time. So be there with your wife. Do everything she needs. Just give her snacks, bring the drinks for her, wipe the sweat on her face, adjust her pillows, make her comfortable in every way and relaxed. Maybe walk her to the toilet, help her to coordinate, breathe during her contractions. So you breathe in and out along with her. Also remember, when the contractions get stronger, she may just scold you. Okay, so don't say anything. Just be there, keep quiet. She's not angry with you. She's just letting go of frustration. Now, if as a husband, you cannot be with her at the time of labor because you might be at work or you may be overseas, you couldn't get back in time. Remember, mothers to be, don't worry. We, your doctor and your nursing staff, we will be there with you. We will support you in every way that you need. Yes, as you heard from that very familiar song, You are not alone. We are here with you. Okay? Your husband gives you comfort. Your doctor will guide you and take care of you so you can be confident. The experienced labor room staff will take care of all your other needs and assist you so you can be relaxed. So you just come to labor room calm, relaxed, confident, and experience the miracle of your baby's birth. Yeah, I would also like to share another example. Now this is the space age and we talk about astronauts. You know, astronauts prepare themselves mentally and physically and they know what to expect. But when it comes to the actual going up into space, they have to sit cramped in the capsule of the spaceship. And when the spaceship takes off, the sound is deafening, the heat, the vibration, it's all terrible. And of course, they are fearful because they are human beings. But once they are in space, they are overcome by the awe and the wonder of space and looking at our Earth from up there, so that when they come back safely to Earth, all they talk about is the wonder of space and what they have experienced. So I would like all mothers to be also not to associate labor with pain and remember the unpleasant feelings you may experience. Treasure the wonder of birth and always remember that. Thank you so much for
Thank you.
listening and have a safe delivery.
Thank you so much, Dr. Elizabeth, for the wonderful presentation. We have one question earlier. It was regarding
Yes.
regarding a woman getting pregnant in their late 30s.
Yes.
One will be: is it advisable for a couple to start planning pregnancy late in 30s? And is there any special care needed if they get pregnant in the late 30s or early 40s?
Are you talking about someone who is already pregnant or planning to be pregnant?
Planning to get pregnant.
Planning to be pregnant, of course, you have to go through a basic medical screening to see that your body is healthy and able to go through pregnancy, that you do not have any medical issues like your physical fitness, first of all, okay, your hemoglobin levels, whether there's any underlying diabetes or hypertension or some condition that you may not have known before, like thalassemia. Okay, these are basic medical issues which may not show up until you do a medical checkup. So that is physical examination. And once you've done the physical examination, your doctor will be able to advise you what is necessary, whether any particular supplements are necessary to build up your hemoglobin maybe, or just the usual supplements like folic acid, vitamin D, simple multivitamin. These are the basic, and calcium. Okay, these are basic supplements necessary.
Okay, understand that, doctor.
Yes.
Thank you, doctor. Just one more question. Somebody's asking for cesarean.
Yes.
The husband is allowed in the room when the procedure is been taken in Metro Hospital.
Because cesarean section is an operation,
Okay.
even for normal, let me go back to normal delivery, vaginal delivery. We have to ask husbands whether they are brave enough to watch a delivery. Because I've even had husbands who have pengsan,
Okay.
fallen down. Yes,
Okay.
because not, not so much as seeing the delivery as experiencing his wife in labor.
Yes.
Some people are so emotionally attached. Okay, so we always tell the husbands, if you're not feeling up to it, just be with your wife at the head end of the bed, to hold her hand, and just be there for her and not to see the delivery if you're not up to it. So cesarean section, for that matter, is a more, what shall I say, unless a person is really up to it,
Needs a strong
See
heart.
your wife being, yes, wife being operated on, you know. So
Understand.
husbands, for metro, husbands just wait outside the labor room, outside the delivery, the operation theater. And as soon as baby is born, we show the baby to the parents, to the father.
Okay, doctor. Okay, doctor. Thank you so much for your presentation today. It's been very informative. Any last words to the new parents to be?
Yes. My one word is do not fear. Do not be afraid. Enjoy your pregnancy. Pregnancy is such a precious time where your baby is in your womb. You know, you're carrying your baby, so precious. Okay, so enjoy the pregnancy. Do not think about uh, labor and delivery. You can read up, you can find out, you know what is the process. That is why I went through the process of labor first before going through the comfort techniques to make you understand what is going to happen when your baby is to be born. Just know that, but do not keep on thinking, oh, will I be able to? Will I be able to? How will I, bear the pain? No, just day to day enjoy your baby's movement, eat well, rest well, take care of yourselves. Okay, and we'll take care of you when you come in labor.
Okay,
Okay,
doctor. Thank you so much, doctor, for taking your
okay.
precious time to be with us today. We hope to see you again
Thank
for
you.
BF Mom.
Thank you so much.
Okay, for everyone, we hope you have enjoyed the sessions earlier. Good afternoon to all who have just joined us. So we will be having our third speaker today, Dr. Zarif bin Hussein. Just to briefly introduce again, Dr. Zarif is the obstetrician and gynecologist at Hospital Wanita Metro. Prior to joining Hospital Wanita Metro, Dr. Zarif has served with Ministry of Health of Malaysia, working at Hospital Pakar Sultan Fatimah Johor, also Hospital Sultan Ismail Johor, and Hospital University Science Malaysia, Kubang Kerian, Kelantan, where he undertook his obstetrician and gynecology specialist and worked in the hospital as well. Dr. Zarif, if you're ready, we all look forward in listening to your presentation. So folks, just bear it with us in a minute. Hi, doctor.
Tak nampak.
Okay, doctor, we can see you.
Why I cannot see you on?
I know we won't be able to see us actually. Okay, doctor, we can see your presentation. Okay, doctor, thank you for joining us today. Good afternoon. So we look forward in hearing share your thoughts on postpartum care for our new parents to be today.
I cannot see my face.
We can see your face.
It's okay lah.
Okay, doctor.
Assalamualaikum and good evening. I'm Dr. Zarifah, ONG consultant at the Metro IVF. Today's topic is postpartum care about the patient info. I want to timing. Okay, our topic today is about postpartum care, especially for patient info related with the postpartum care. What is postpartum care? Postpartum period is whereby the baby deliver after the baby, where the period after baby deliver up to 6 week duration. In other way, we call that the postpartum period is postpartum care is pantang lah, kan, tempoh berpantang. So Chenho ataupun dalam bahasa Mandarinnya Chan Hao, dalam bahasa Tamilnya Parasavi Tirkupin. I try my best lah. Okay. When we talk about postpartum care, you must understand what is happening. So what is important in postpartum care? Postpartum care is about care for mother and baby, especially for penjagaan ibu dan anak ketika pantang is important. Okay, and at this moment, this is adaptation process, right? Why I'm saying adaptation process? first adaptation from the in life from single to married, and then after that you will accept the new family member, new responsibility first. Second adaptation from the pregnant condition. Sebelum ni you are pregnant, so all the hormone is high, especially progesterone and estrogen high. So your body also changing, body shape changing, okay? So you punya emotional also changing. So during the postpartum period ni, what happening? All the hormone try to become in non-pregnant punya hormone. Dia akan ke arah daripada high terus jadi reduce ke arah not pregnant, ke arah yang tidak pregnant langsung. Perubahan period. That's why they up to 6 weeks. Kajian study shows the period is up to 6 weeks because of why? Because all your hormone become to the normal backs. During the pregnant it high to save the baby. That's why all the problem may happen during the postpartum period. This is a very crucial about your emotion, about your body shape, about your sleeping times. All this happen during the postpartum period. It's important 6 week duration. Why it happen during postpartum depression happen also during the 6 week duration. Okay. When we talk about the adaptation, so you must understand the new family member, new responsibility. This is very important point. So next, why the postpartum follow-up is important? So for first of all, we need to monitor about the mother and baby, especially the vital sign, the blood pressure, okay, the pulse rate. So any hemoglobin changing for the mother first. And then as you know, we take the neonatal jaundice, we take the bilirubin to see any neonatal jaundice. If the 1 week after delivery, it may be related with physiological jaundice. So how to encounter, because this is changing with the hemoglobin, the baby hemoglobin. From the fetus hemoglobin to the newborn hemoglobin is different, okay? So at the same time, it's also changing the jaundice. We are monitoring closely the jaundice issue. Why? We are afraid the jaundice very high, afraid affect the mental status for the baby. Okay, that's why the doctor frequently asking to give the appointment very short, 1 day, 2 day, 1 day, 2 day. Okay, so at this moment yang you kena bagi the baby adequate breastfeeding. Maksudnya memang kena buat 3 hourly, 2 hourly, 3 hourly to prevent from the neonatal jaundice. Okay, don't adding any air masak. Ada setengah dia bagi air masak, tak. No. If you not adding also, is a meat yang betul-betul for newborn. Okay, so we very emphasize, we very highlight mother punya breastfeeding, mother punya breast milk is very good. Okay, so first. Second, to monitor the mother punya mental status. Why? So this period during the 6 week duration is a high postpartum stress and postpartum depression, or postpartum blue, postpartum psychosis, emotional. Why it happened? Because of first hormonal changing, hormonal become normal first. Second, most of the postpartum mother lack of sleep, lack of rest. Why? To breastfeed baby. That's why they kurang tidur, dia rasa tak cukup tidur, tak cukup exercise. So this condition yang may lead to the postpartum depression also. At the same time, the support, the family support, adequate family support, husband support, this is important. Why? That's why the mental status may affect during the postpartum period. After 6 weeks, they already adapt with the situation. So that's why no problem, no hormone issue. So that's why the 6 week duration. That's why in Malay culture we have a 42 untuk Jawa, 36 untuk Melayu. Tak silap saya kot. Wife saya 36 dan so 42 equal to 60 dan 6 week also sebenarnya. So dia punya pantang period tu is about 42 days and 36 day. Ada 36 day, okay. So first about the monitor the mental status. Number 3, during the postpartum follow-up, what we doing? So kita akan check the luka, especially kat mikro kita akan buat apa? After you buat cesarean section tu, 1 week duration kita nak tengok monitor any wound breakdown ke tak. Tadi tu kita nak tengok the cesarean section punya wound okey ke tak. Dari segi episiotomy wound, kita buat episiotomy, kita potong episiotomy tu keadaan di mana the perineum bawah tu kita potong untuk bantu baby keluar juga lagi. Okey, untuk elakkan daripada muka tu terlalu besar. Satu. Nombor dua, dari segi perineum wound juga nak tengok how the perineum wound tu untuk improvekan daripada dia punya nak tengok adakah recovery good untuk perineum care. Okay. So first, if any wound breakdown, so we can intervene early, especially cesarean section punya wound. Tengok nampak ada wound breakdown, so we intervene early. Either we want to open back ataupun just observe. Okay, in which condition we decide based on the wound condition and the mother condition also. It doesn't mean you come jumpa tengok buka sikit kita terus buka, tak. Kita akan assess teliti. Either this wound is memang 2x2 sampai abdomen ke tak, dia punya wound breakdown. So first. So number 3 for the examination cesarean. Episiotomy wound, kalau breakdown, rarely kita open balik and kita jahit balik, rarely. Because we encounter if you open, jahit balik semula, the wound is not strong enough to help. So dia punya recovery jadi lambat. Okay. So number 4, during the postpartum follow-up, what we are doing, we discuss back the contraception option. Contraception option tu untuk kita ada implanon, for example, we have the Mirena, we have IUCD, or any pill contraception. So when we decide to give, usually we decide at the 5 to 6 week postpartum period. At this moment, we discuss with the mother and the husband also, whether you want to proceed with the long-term irreversible, for example, implanon IUCD contraception or short-term contraception. So why it's important? It's important, guys, to understand the importance of contraception. First is for family support, family economical or financial issue. Number 2 about the spacing. Okay. So about you punya kasih sayang, care about you, the yang baby ni bersama. Maksudnya kalau you buat kalau you terlalu rapat, apa yang berlaku? One of you punya akan lack of attention. So tu yang kadang-kadang you risau takut ada attention deficit issue, right? Okay. So number 2. Number 3, what is happen? The mother punya condition tak baik lagi, and then you next year nak pregnant lagi semula. What happen? So that's why they lead to anemia in pregnancy, hypertension. So they may contribute because of your punya condition, PPH. Okay. And then number 3, number 4, what is important of contraception is you want to is about the quality nowadays, not about quantity at all. Even though kata anak tu rezeki, but you must understand how to raise a child nowadays. Not the same like if kita punya grandfather or father punya macam mana they are raised us. Okay, that different. So number 5, during the postpartum follow-up, we will update the vaccination plan, the nation vaccination plan. Okay, the last one to assess whether your breastfeeding technique is good or any important technique that we can share with you, so to improve your breastfeeding technique. Okay, this is about the why important for follow-up. Okay, postpartum issue. Let's understand about the postpartum issue. This is a lot of postpartum issue. First is related with the infection. Jangkitan kuman, for example, any urinary tract infection, any kidney infection, any, for example, wound breakdown. This is postpartum infection. What the sign? If you have fever, if you have any forced smelly discharge, if you have any abdominal pain, it means postpartum period. Lepas balik tu you sakit perut sangat teruk sangat, and then you punya keputihan tu bau busuk sangat, and then ada demam, jumpa doktor segera sebab we are afraid there is infection inside the uterus. This is important. Number 2 is the issue yang kita concern, the postpartum hemorrhage. This means excessive bleeding after delivery. Maksudnya lepas bersalin tu tumpah darah banyak. Okay. For example, hari pertama you datang, you balik mungkin 1-2 pack, tak ada masalah, no issue. Suddenly, hari ketiga, hari keempat, increasing the pack amount. So, come to seek a treatment urgently. Maksud jumpa doktor cepat. Why? First, what the important? Because first, we are afraid any infection inside the uterus may contribute to the postpartum hemorrhage. They may contribute the excessive bleeding after delivery. So number 2, what we are afraid, there is any blood clot, that retain blood clot not fully evacuated, means dia punya darah tu dalam darah beku dalam rahim tu still tak keluar lagi. So means dia takut keluar extra banyak. Nombor 3, takut any tertinggal uri ataupun tertinggal tisu kat situ. Benda jarang berlaku sebab apa? Jarang berlaku sangat. Dia boleh berlaku tapi jarang sangat berlaku. Okay. Number 3 is the issue related with the pain during the perineal episiotomy. So this norm, so pain tu sakit tu akan berlaku dekat episiotomy site up to 3 days. Usually episiotomy 3 to 5 days. Okay, cesarean section may up to 7 days, or yang paling worst boleh up because of the wound healing up to 7 to 2 weeks. Okay, wound healing, total healing, inside healing. Okay. So about the forced smelly vaginal discharge, as I mentioned before, forced smelly discharge may related with the any infection. This is we highlight. Okay. So the breastfeeding problem, especially breastfeeding problem issue is the main issue actually. Why? Especially untuk first pregnancy. Okay. If I have time to share you how the breastfeeding technique, I've always been technique for next presentation, maybe in future about the breastfeeding because I've encountered during my first child tu difficult juga sebenarnya, even though we know the technique, everything, but how to apply it's very difficult sometimes. Okay, we may encounter with the breastfeeding problem. Okay? So breastfeeding problem especially untuk first child memang akan issue dari segi breastfeeding teknik, dari segi susu tak keluar banyak, production very lax. Kat situ kita akan ada problem dari segi breastfeeding problem and breast problem. So some of them, bila breastfeeding technique itu, so dia akan lead to breast problem, swollen, infection, atau breast engorgement. Okay, number 6 is a stretch mark. So how to remove the stretch mark? So tu yang encounter. Okay, buat a stretch mark, kalau you belum bersalin lagi, apa yang saya selalu advise my patient, you start lah pakai any ointment or any cream starting at 18-week pregnancy, 18 minggu pregnancy tu dah start pakai cream, that cream, any cream. For example yang kita I advise my wife punya warna orange punya oil, apa nama dia, oh my god, I forgot the name. Okay, you apply any oil or any cream, lotion at the 18-week pregnancy, starting 18 to 20-week pregnancy starting. Why? Because masa 18 hingga 20 minggu tu perut tu baru nak nampak, baru nak kembang, baru nak besar. Kat situ you can encounter the stretch mark. After delivery you nak encounter stretch mark, very difficult actually. Can, but very difficult. It takes time. So another is a hemorrhoid and constipation. So about hemorrhoid and constipation, so most of the pregnant women may encounter constipation. Why? Kenapa? Dari segi pemakanan. First, you mesti makan yang high fiber diet with the good hydration. Okay. So any urinary or fecal incontinence. Okay, this is the issue. Another one is related with any urinary tract infection. Kalau urinary incontinence may be associated with urinary tract infection. If you are encounter with the fecal incontinence or urinary incontinence, seek the treatment. Find a doctor. We want to examine back at the perineal region any problem, any issue. Hair loss is common. Okay. Okay, most of my patient akan tanya, doktor, kenapa rambut gugur, macam mana nak buat? Because why? Because you must understand your hair is related with the hormone also. So this time you akan berlaku hair loss ni, that is not permanent, it's a temporary. up to 6 weeks. After 6 weeks, may recover back hair loss because of all your hormones start to become a normal back at this time. And postpartum depression. Postpartum depression is one of the issue. So postpartum depression is a serious condition. I have one case yang postpartum depression in commit suicide. Is very very dangerous. Guy, if you encounter any stress, if you have encounter any mood swing, any sadness, and then affect you punya mental, seek the treatment. Okay, discomfort during sex. Okay, is one thing. So that's why we are advised to start any sexual intercourse maybe up to 3 weeks onward, the earliest, or 6 weeks after that lah. So difficult regain your pregnancy. Yes, it's all most of the pregnant women encounter. That's why we emphasize exercise. You can do exercise and then good and healthy diet. This is postpartum issue. Right. Okay. Today we share about husband role and wife role during postpartum care. Okay. Sometimes husband is the man, the important person during the postpartum care. First, dari segi religion practice lah. As a Muslim, after delivery kita kena azan, tahniah, syukur, sedekah, and cukur rambut, akikah, and beri nama is important. Okay. So number 2, register baby name at JPN. Okay, why important, guys? I nak beritahu you this is important. Online appointment, please do and then book your appointment before delivery. Why? Already full up to February. Last I register my kid yang baru bersalin Adam Korni ni bulan 9 hari tu. I register bulan 5 baru dapat hari untuk bulan 10. So, siapa yang belum register, this is a website and you can register and make a temu janji untuk where you want to do the JPN because of kelewatan more than 2 months, dulu 1 month, 2 months dia baru denda lah. So, you must register, jangan walk in, tak ada walk in. You walk in, tak dapat masuk langsung, okay? So, you must register untuk buat appointment kat JPN. So, this is a borang-borang yang akan kita bagi. Jangan risau, tak perlu salin, nanti saya akan share my ebook also. So, borang-borang, borang ni kita akan provide. Selalunya hospital metro akan tulis barang-barang yang apa yang perlu, checklist semua yang perlu, dan you are prepared for this checklist before going to JPN. So guys, please book the appointment early because appointment already full. Memang dah full untuk JPN, untuk pendaftaran nama. Okay. Number 3, husband punya role, provide and support wife breastfeeding. Maksudnya dia kena prepare equipment yang perlu, breast pump, milk booster, okay, milk container, storage, okay, of plastic and breastfeeding bag. And the important one is emotional support and motivation. Okay, I want to highlight about the breast pump tu actually is a depend on you punya kesesuaian. You nak guna yang mahal ke ataupun yang murah ke, it's up to you. Tapi kadang-kadang you beli yang mahal tapi tak sesuai, suction dia tak berapa kuat. So everything you nak beli yang dual suction pun boleh. Okay. So milk booster, we have a lot of milk booster actually. For example, like sayur bayam. For example, is kita ada lobak putih, lobak merah. Okay, kita ada coklat, durian. Semua milk booster. And we talk about kurma, madu, okay, susu. Okay, this is a milk booster. At the same time, you can maintain hydration. Maksudnya kena cukup minum air. Air ni at least 1.5 liter per day or 2 liter per day. To give you punya breast to good milk production. Okay. So you nak tengok macam mana you tengok you punya breast milk. Macam mana you punya production. Satu, related with the breastfeeding. You kena buat, you kena ada timetable, frequent. Maksudnya kalau you buat 4 hourly to maintain your brain nak beritahu, hello, this is at the time dia kena keluar milk production. So breast dia akan beritahu, okay, dah kena prepare untuk breast production. That's why kena ada schedule. Jangan ganggu, jangan tak ada schedule. Maksudnya kalau you buat breast milk pukul 2 petang, next lagi 4 jam, pukul 6. You nak buat macam tu lah after this, 4 jam, pukul 10. Maksudnya every 4 hour or every 3 hour lah. If you have time, 3 hour lah. If you don't have any time, you may buat 4 hour or up to 6 hour. Maksudnya 4 hour. Okay, depend untuk maintain the milk production. So the milk production is important. Okay, so your breast feeding technique is important also untuk have the breastfeeding punya production also. Ada soalan tak? Okay, taking care of baby together. Okay, I want to highlight with husband also. Sometimes bila you nak support dari segi breastfeeding, emotional, depression, semua pada untuk rest, just give sometimes taking care the baby together also. Why? Doing the baking, untuk mandikan baby, changing the pampers or cuci botol susu is important. Okay. So you must number six you must aware any problem, any changing in a wife punya problem. I have one case yang alhamdulillah husband dia dapat alert yang kenapa dia punya wife ni nampak lain macam, nampak macam nak marah, nampak macam sedih, mood swing macam rasa kosong. Sebelum tu dia dah beritahu kat husband je yang dia sakit telinga lepas dia demam, tiba-tiba mood dia swing, terus jadi teruk macam teruk, and then mula-mula husband dia ingat kena santau lah, kena buat benda semua everything, tapi the best part husband dia buat apa, husband dia bawa pergi jumpa doktor terus. Rasa macam pelik lah, takkan ada orang nak bomoh dia semua everything tu, dia bawa jumpa doktor. What we found out, there is a postpartum punya otitis media, infection dalam bidang telinga, tak tahu macam mana dapat kan, end up sampai dalam kat brain, ganggu dari segi, dia bukan related dengan psychological, in fact dari segi benda lain, maksudnya sebab tu important kalau nampak any changing in behavior dekat mother punya, you punya wife behavior, seek the treatment early. Because why? We may rule out other cause. This is another condition that I encounter. So masa time tu kita apa benda berlaku, takkan ada orang macam kita check, jumpa psychiatrist kata most likely postpartum flu, postpartum depression. So bila kita tengok dalam telinga memang ada nana keluar dari telinga. This is another condition yang I pernah encounter. Okay. So support family is important about the family planning or contraception method. So husband, please give the permission or discuss properly with the wife, because yang pregnant tu wife, yang sakit badan yang berat itu adalah wife. So important untuk husband to support, to discuss the contraception technique untuk wife. Financial memang you yang control juga sometimes. Okay, so at the same time, accompany the wife and baby during the postpartum checkup because you want to know the progress. Okay, good. If you encounter and then at the same time your wife akan rasa happy, ada orang yang company, dia punya depression, dia punya stress akan reduce. It's important, okay? And then the last one, provide the good environment and play. For example, you preparekan good condition, good environment untuk dia rehat juga sebenarnya. Bila dia cukup rehat, depression kurang. Bila dia cukup rehat, milk production bagus. Bila dia cukup rehat, dia akan dapat exercise yang bagus. Dan bila dia cukup rehat, your baby pun sihat. Okay. Wife. Okay. Untuk wife role pula during the postpartum period. First, you make sure you did the exclusive breastfeeding if possible. Okay. So because the breast milk is the best one for immunity, for the baby health also is important. And eat the healthy diet. If you nak follow pantang punya makanan severity, you can follow actually sebenarnya. And then adequate rest and sleep if possible lah. So make sure you have adequate rest and sleep because to prevent any depression and stress, and body massage also. So body massage ni, it doesn't mean you nak kena buat body massage tu yang kuat, just untuk relieve you punya muscle stress kadang-kadang. Okay. So untuk perut caesarean section memang kita tak advance langsung lah. Memang kita tak advance, jangan musik kat bahagian perut punya massage, cuma buat sendi-sendi, lim-lim semua boleh massage. Okay. So untuk pantang depend on you punya religion or you punya race, macam mana the weight of dia punya pantang. Ada orang kena pakai, if selagi tidak memudaratkan boleh. Contoh for example yang memudaratkan, ada setengah pantang tu dia kata mitos kot, mitos. And if you minum air masak banyak, dia akan menyebabkan rahim tu berair. This is mitos. Okay, this mitos. Why? Bila you tak minum air masak banyak, apa berlaku? Satu is dari segi milk production totally drop. Number two, what is happen is you akan risk untuk dapat deep vein thrombosis. Apa tu? Maksudnya darah beku kat kaki. Darah kat kaki ni bahaya, boleh menyebabkan tersumbatkan ke paru. So bila tersumbat kat paru tak dapat oksigen, menyebabkan kematian. Kat situ risau. So remember, hydration is very important. Adequate hydration untuk improvekan you punya condition. So if you stress, please reduce the stress or talk to people yang you rasa comfort untuk share. Okay. So you can wear the pad or sanitary to monitor the blood clot. You can use the sanitary pad or tampon. Tampon you boleh guna sebenarnya actually is also another way yang boleh guna tampon. And then you boleh guna yang betul kalau untuk hygiene punya condition you boleh guna apa tu apa pakai buang punya panties okay? You boleh beli dekat 70 ada jual 70 dekat farmasi ada jual. Okay, so aware any bleeding increasing and then highlight to the doctor to seek the treatment. And personal hygiene is important guys, so memang jaga kebersihan, especially nipple punya bad hygiene. So kalau you tak jaga nipple punya hygiene, they may lead to infection to the baby also. Always communicate with husband or any family member if any problem or needed. So apa yang keperluan yang perlu ataupun apa yang berlaku masalah, you kena highlight dengan husband. Exercise, what the earliest exercise you boleh buat untuk normal delivery, paling awal you boleh buat exercise is up to 3 days. Untuk cesarean section after 7 days kita advise lah. So exercise macam mana contoh, boleh buat betul pelvic floor exercise, you boleh buat apa tu, you boleh buat brisk walk, jalan sikit, okay, ambil buat yang guna bola sikit, tak ada masalah. Dan untuk bikin apa bagusnya exercise, what is important exercise? First, untuk reducekan your stress. Number 2, untuk regain balik your body shape. Maksudnya dah gemuk balik semula, tu regain balik semula. Number 3, what is important of exercise is untuk reducekan punya weight. Right? The another one is compliant with all the medication yang kita bagi, especially hematinic, ubat tambah darah. And then at the same time, kita akan bagi juga ubat cairkan darah, any heparin or flexin to prevent the deep vein thrombosis, prevent darah beku ke kaki. Last one, if any follow-up, please come and visit us. This is checklist yang I shared same juga. So I just highlight again the summary. For first, for this duration, this era, so you must limit the visitor. First, why important limit? You can good rest and less contact in the COVID-19 patient. Just highlight to the family member, just you want to see us after pantang lah. Untuk limit the visitor. Okay, limit the visitor is important. Hygiene is important. I already highlight the hygiene. With the help, get help. And if you tak boleh, you get help any maid ataupun family, your parents untuk bantu dari segi cleaning and you punya meal. And follow up. Follow any follow the doctor instruction. About legs. Legs, what is important in legs to prevent any leg edema, to reduce the leg swelling. Masa pregnant, you akan kaki bengkak, okay? So, how to reduce the leg swelling after pregnant? So, this is the way. Maksudnya, letak bantal dekat bahagian kaki, kat bagi, nak tidur, letak bantal sikit. So, dia akan kurangkan, surutkan all the leg swelling. Okay? And then, boleh mandi. Kalau paling bagus, mandi yang warm water. Why? Because untuk refresh, relief. Okay? At the same time, you boleh buat seat baths. Maksudnya, dekat bahagian vagina tu, kita panggil untuk bagi walk saja dekat vagina punya bahagian faraj tu, you bagi walk, air tu bagi walk, bagi walk macam steam, macam sauna punya condition, bawah tu bagi air, dan kena air panas, bagi walk saja naik. Why? Untuk healing, untuk fast healing dekat bahagian vagina, perineum region tu untuk jadi lagi, stomy wound tu jadi lagi cepat sembuh. Okay? Any lotion you can apply untuk fade the stretch mark. Dah sampai 30 minit saya cakap. Okay, the another one is eat the healthy diet lah, or the food, vegetable. So wear supportive bra is important juga. Why? You jangan guna ketat punya bra. Why? Dia akan jadi you punya milk production akan terganggu juga. At the same time dia akan jadi pain dekat bahagian you punya breast. Okay, at the same time, cream, apply any nipple cream if ada you nampak for sore nipple ataupun any sakit tu you apply lah. Drink a lot of water, just appointments, follow up, continue. Talk with the people if you are sadness or any depression. Call for help if you have any problem. And then taking care yourself and your baby is important guys untuk give a new energy, especially. And if you have any constipation, constipation drug you can eat. So talk to your doctor. Your doctor will give any constipation drug. Example like kita ada lactulose, kita ada liquid paraffin. So this is one the important one lah. Make the time for you and ask for help when you need that lah. Ask for help lah. It's important. Kalau you rasa jangan duduk bersendirian, dan first of all jangan share your problem with others. It's important. That's all from me.
Thank you so much, Doctor, for the valuable information that you have shared with us. There is some question coming in the Q&A box. Doktor ada masa ya untuk jawab?
Ada.
First question is, what would be the extra care or precaution for first pregnancy in the mid-30s?
What will be extra care? 35, mid-30 means more than 35 years old.
Yes.
Okay. First of all, extra care and precautions for the first pregnancy. Okay, for first pregnancy, what is the extra care that, especially more than 30 years old, 35 years old? So start from the antenatal care. If you want to talk about the antenatal care, what the extra precautions? First of all, you must know if you are pregnant more than at the age of more than 35 years old, you should have any detailed scan or any trisomy or any chromosomal scan, chromosomal blood screening, or we call that is a triple test or quadruple test, or an ICT or an ICT. This one is to detect any Down syndrome, any Edward syndrome, any Turner syndrome. This one is important, okay? Any Patau syndrome. So all the syndromic, because in the age is a chromosomal anomaly in this age. It's extra care. Number two, you just be prepared if you are pregnant after 35 years old, especially. So you have risk of first is hypertension. Number two, second is you have risk of diabetes also during the pregnancy. Number three, your pregnancy is similar with others also, but it's an extra care, and you must highlight about the emotional issue. You more sensitive compared than the emotion more sensitive compared than the teenage pregnancy. Okay, so number four, you make sure you have a good antenatal care, good sleep, good rest, and good sleep. Sleep means you kena tidur sebelum 12:30 malam, and at least you punya sleeping time to 6 to 8 hours, right? Number four. Number five, so actually the extra care. So another extra care yang kita boleh advise to eat the healthy diet lah. So don't worry guys, the first trimester you akan rasa food craving yang teruk sangat. Ada setengah orang dia akan dapat food craving yang macam, oh my god, food craving teruk sangat. Okay, ada setengah orang tak ada food craving. So eat apa yang suka, just control you punya gula. Jangan terlalu banyak sangat gula you makan. Okay, what is a dangerous gula? It's risk untuk, ada risiko untuk baby meninggal dalam perut. Intra you can that this is we are afraid kalau gula terlalu tinggi. Okay, untuk age, okay, this is important. Answer. Postpartum care ni nanti akan bagi ibu yang risau, saya akan bagi dekat organizer untuk share ibu with you all dekat email. What food to avoid during the after the week, is it safe to take jamu? Hi Puan Komala, thank you for question. So for jamu, okay, there is no research or any study related to jamu. Jamu ni apa? Jamu is related with any akar kayu, any traditional medication. So I'm not very emphasized for jamu actually. Why? Because I takut dia affect the breastfeeding, affect the breast milk. Yang tu kita risau. Kena ingat apa yang kita makan, what we eat now, what we eat will affect the milk production, milk quality. You makan durian, anak pun akan rasa durian sikit. Mungkin tak ada sign evidence. I've seen because I tengok my wife makan dah sikit tengok my kid rasa macam dia punya najis tak berapa menarik sangat. Faham tak? Kat situ you akan tengok you makan apa what you eat, your baby punya breast milk akan effect. So I'm afraid the jamu will affect the baby condition yang lead to jaundice, lead to baby jadi rasa tak berapa bagus. This is important, jamu. Okay, it's about jamu. I tak berapa advice untuk jamu. If you nak makan after 6 weeks duration, after you dah lepas pantang, you just untuk balik regain your shape. Mungkin if tak dangerous, you punya head lah. Saya tak ada no kajian or no scientific evidence that say jamu is a safe. If you want to take after 6 weeks, after 6 weeks of pregnancy, so I'm not very I'm not very empower untuk take jamu lah. So what are the food to be avoid during the postpartum period? Okay. Actually, during the postpartum period, the condition is a fast food. Like you must avoid high sugar diet. You can avoid. Okay. At the same time, what is a food yang you should avoid is the food that rich with the iodine, which means, for example, macam ikan sardin. Nanti try to avoid juga lah sebenarnya. I tak highlight sebenarnya ikan tuna. Sebab apa dia contain of high mercury, bukan iodine, mercury. So high mercury will affect you punya mood feeling also. Is important yang kita ikan parang, if I'm not mistaken, another one yang kita try to emphasize. Because any food yang related with mercury, especially seafood, mercury, word is a mercury, high mercury food. So you try to avoid lah. So another one is a fast food or any sugar, high sugar food lah. Is the speed of recovery depend on the age? Okay, good. Yes, there is a research related with the age. If you teenage, young age, and compare with the age of 35 years old, age is play a main role. Why? First, dari segi punya immunity badan, hormone level, dari segi punya all general organ punya function. This is important. Age increasing, you punya recovery punya condition is reducing. Okay, any question?
Okay, doctor. There's one question there. Is the speed of recovery depends on age? I mean, I think she means the recovery from labor.
Ada jawab tadi.
Oh, dah jawab. Okay.
Memang depend on age. Means if your age increasing, speed recovery will reducing.
Okay, doctor.
It doesn't mean 100% will reducing lah.
Okay. Is there any last words, doctor, for the participants today? And if they have any questions, can they contact you in any other way?
Okay. My last word, postpartum period or pantang period is an important one. Why? I'm worried about the postpartum depression. So if you have encountered any depression or stress, please are familiar that the people with you are comfort to share your problem. Okay, because postpartum period is another one of the maternal mortality. And then please compliant with the doctor follow-up, because during the follow-up, doctor will assess your mental status. So maybe you tak nak cakap dengan people, tapi doctor will assist help your wife also during the postpartum period and understand her. Okay.
Okay, doctor. Thank you so much. Thank you, doctor. We hope to see you again.
All right. Thank you.
Thank you so much.
Bye.
Okay, so thank you everyone for joining us today for our BFMum antenatal webinar in collaboration with Hospital Wanita Metro. So we come to the end of the session where we will be mentioning the question for the grand prize winner of Pigeon's new award-winning Go Mini breast pump worth 427 ringgit. The question is, how much does the motor of the Go Mini breast pump weigh? How much does the weight of the motor of the Pigeons Go Mini Breast Pump Vase. Y'all may mention the answer on our BFMum Facebook page by mentioning it below today's event poster on the wall. And please do like our page as well, as we have more antenatal webinar session coming in next month. So lastly, thank you again for joining us. Thank you, Hospital Wanita Metro, and our corporate sponsors, Pigeon Malaysia. We hope everyone safe pregnancy, and we hope all will stay safe at home. Thank you so much. Thank you. Good day.